Let's go.
Dr. Rosie Milligan, one of the most sought-after speakers on the circuit today. Her live internet talk show, Express Yourself, is the most provocative, thought-provoking, and talked-about radio show on the internet. There's no holds barred, and Dr. Milligan puts the B in bold. She brings it every Tuesday live at 10 a.m. Pacific and 1 p.m. Eastern Standard Time. Dr. Rosie has been proclaimed the most provocative female writer of the century. Her books include Satisfying the Black Man and Black Woman Sexually Made Simple, Why Black Men Choose White Women, and the book Nigga Please. These books have raised eyebrows across the country. She has authored 21 books and published 350 titles for authors nationwide. Check Dr. Rosie out at drrosie.com for her books, articles, and archives of her internet talk show. Sit at the feet of wisdom. Dr. Milligan is indeed a timekeeper and scorekeeper. She is the clock, calendar, and almanac for Black America. You need to hear her.
Sunny California. You listen to the Express Yourself Hour. I am your host, Dr. Rosie Milligan, coming to you live as always. You know how we do it around here? It's nothing but straight talk. My co-hosts are the wonderful, we call him the Invisible Man. You guys know who I'm talking about, Mr. Keith Swanson. Everybody's been looking for him for the last 2 years. They don't believe he exists. I keep telling them he is real. He's live, he's in color, he's at most of my events, and you all have not identified him yet. The money on the table for those who recognize who Keith is, there's money on the table and it's still growing. So you guys, come on, you're going to break my bank account. Good morning, Keith. How are you?
Good morning, Dr. Rosie. How are you?
I'm doing wonderful. I'd be glad when somebody recognizes you so I can, you're about to break my bank, man.
The price of my head goes up, huh?
Yeah, instead of going up. I don't know why they don't recognize you. They still say, I didn't see him. I said, just listen for his voice. He's all around you. Well, one of these days, Keith, one of these days. My other co-host is wonderful. That's Shawana Bourdonnais. I guess she's on today. She's a real estate guru. She's probably out selling houses, buying houses. She's doing something with houses if she's not on here. If she's on here, just say hello to the people, Shawana. If not, I know you'll join us later. So I guess she's still out selling, right, Keith?
She's out shaking her money maker. So, she out there making that money.
All right. I'm not mad at her.
I'm not mad at her.
No. Well, we have a great show for you today, and we have a great guest. I'm really excited about this show, excited about the guest, because I know she's going to have a lot of great information for us today. We're going to be talking about facts about Medicare coverage as related to long-term care. And someone asked me, well, why are you doing that topic? The older you get, the more you get concerned about long-term care and everything else. But really, my real motivation, because I run into so many people who think because they have Medicare, Keith, that they have carte blanche. I mean, like I said, when I first got my little red, white, and blue card, I thought I could get up on the bus and ride the bus tree with it, I thought I had all those kind of benefits. But people have no clue. They're just excited. Oh, I got Medicare. They feel like they can relax and don't have anything to worry about. Because who would ever think, if you didn't know that if you had Medicare as your insurance, you would never think that there was a limitation on it. Would you think so, Keith?
No, not the way they sell it, no. But
no, most people wouldn't think. They think I got it made. Whatever happened, I don't have to worry about doctor bills. I don't have to worry about anything because Medicare got my back. And that is truly how majority of people think. So that's why I wanted to, I do this show. Let me introduce my guest. Today, we have with us as our guest, Mrs. Denise Ridley-Davis. She's a financial professional and life insurance agent since 2006. She's a certified financial planner since 2013 and a Medicare enrollment agent since 2018. Did you guys hear what I said? A Medicare enrollment agent since 2013. So that let us know she knows a lot about the topic that we're going to talk about today. Good morning, Miss Ridley-Davis. How are you?
Good morning, Dr. Rosie. It's a pleasure to be here. You have been a friend and a supporter for many years, and I've referred many satisfied clients to you. So I know that you emphasize living trust with your clients, and that's also an area that I emphasize because it is so important and makes such a big difference in people's lives, the survivors.
And I thank you so much.
Oh, you're very welcome. So our emphasis today is on long-term care coverage with Medicare.
Right. And as I was saying, what brought me to this topic, because I consider myself fairly intelligent, and most people do. And there was so much about this that I didn't know, and that I didn't know what I needed to know. When you don't know that you need to know something, then you don't tend to even seek out that information, because I was just so sure I got it covered, carte blanche, until I began to listen to people who were saying, well, I only have so many more days I can be in the hospital, or I'm going to have shared costs. And I go, what? So I think there's a lot of people that's in the same boat that I was in. So that's why I'm so thrilled today that you're here to help guide us, so we'll know what we need to know as we begin to live longer. People are getting older, so we need to know the information that older people need to know, that we're not forgotten. So today I just want you to just tell us what we need to know, what we need to do to protect ourselves, since we don't have coverage forever. Then what can we do not to become a burden on our children, a burden on society, or just what do we need to be doing? And at what age do we need to start looking at this?
Okay. All right. You just spoke about you don't know what you don't know. That's exactly what you just emphasized. Okay. And also, I would like to give my email address, because we're going to have question and answer period. And if there's some questions that need to be answered, or you think of it later, you'll be able to contact me. So my email is Davis.Denise69@gmail.com, and my phone number is 310-721-7397. So
Can you repeat that, Denise, just one more time?
310-721-7397, and the email is Davis.Denise, DENISE, 69@gmail.com.
Thank you.
I am currently licensed in California, New York, and Florida. So this presentation is specifically for California, because rules change in different states for some of this information. These are the questions that were posed in the invitation that we'll be answering today. Will Medicare cover the total cost of skilled nursing care? Does Medicare provide nursing home coverage indefinitely? Can you pay out-of-pocket costs after Medicare coverage ends? And do you have a payment plan in place to cover the extra costs of long-term care? The 4 parts of Medicare, the ABCs. Part A is for hospital coverage. Part B for Medi-Cal coverage on an outpatient basis. And Part C is called Medicare Advantage, which usually includes medication and drug coverage. So we'll go over that as well. The Part A hospital insurance coverage when you're an inpatient for basic Medicare, which is called Original Medicare and consists of Part A and Part B. Original Medicare covers 80% of your costs. And the Part A portion, inpatient hospital care, also covers a limited number of days in skilled nursing facility. And that's an area that we will be emphasizing in this discussion. It also covers hospice care for the terminally ill, home health care, and nursing home health care. Part A usually has no premium for the majority of people, but it has a deductible for hospitalization of $1,556. For skilled nursing facility in 2022, this is the important part you need to remember and take note of. You have 100 days of coverage for skilled nursing facility care. You do not pay anything for the first 20 days of a benefit period. You pay $194.50 per day for days 21 through 100, and you pay 100% out of pocket for each day after day 100 for basic original Medicare. Let's go to Part B. What is Part B covering? 80% of your medical bills for outpatient visits to the doctor or specialist or the surgeon who does your operations. It covers lab work, x-rays, preventive screening, and other outpatient services. Part B requires a premium of $170 on a monthly basis. And this amount may be higher if you're a high-income individual. It also has a deductible of $233 per year. And if someone does not sign up at age 65 or at the time of their retirement from their work, there can be higher premium costs and penalties. So here is another important point. Medicare does not cover long-term care, also called custodial care, if that's the only care you need for your personal care. And most nursing home care is custodial care, which means it helps you with activities of daily living. Let's talk about what the activities of daily living are. It refers to those activities that someone cannot do for themselves. And here we go through the alphabet again, A, B, C, D, E. Ambulating or getting in and out of bed or a chair, bathing, continence, being able to go to the bathroom by yourself, dressing and eating, and also toileting, which is taking care of your hygiene. As we mentioned earlier, Medicare covers up to 100 days per benefit period. So we're going to address what benefit period means now. So it covers 100 days per benefit period in a certified Medicare facility once the doctor states that's what you need. And you need to have 3 qualifying days inpatient in the hospital or in the skilled nursing facility in order for this to be effective. So as mentioned, 0 for the first 20 days and $194.50 for day 21 through 100, and then you're responsible for the cost. You can become eligible again for Medicare coverage for your skilled nursing facility care once you've been out of a hospital or skilled nursing facility for 60 days in a row. So keep that in mind. When we say 100 days of coverage for long-term care. It could be another 100 days if you've been out of the facility for 60 days in a row after, and then the new 100-day period begins after you've been in the hospital inpatient at least 3 days. All right. So,
Denise, can I just ask you a question just to clarify maybe for some of the listeners when we talk about skilled nursing facilities? Just what are we talking about? Because some people get mixed up with skilled nurse facility, and they call convalescent home. They have different names that they call for different facilities, so they'll be clear about the skilled nursing facility.
Oh, skilled nursing facility refers to a institution where that's certified by it has to be certified by Medicare. First of all, the doctor has to place an order stating that you need skilled nursing or other skilled professional services, someone who is licensed. So the skilled nursing facility provides the doctor's services, provides nursing, and also, as a matter of fact, Part A. This is actually the information I was going to next. Physical, speech, and occupational therapy is also considered skilled social services. And in a skilled nursing facility, you would get medication, the equipment you need, and transportation to a provider if you can't go by regular transportation. So the most important part of when I say skilled nursing facility is that it has to be professional, licensed individuals, not just a nurse aide, for example, someone who can help you around the house. That's custodial care. So that's a distinction. If it's only custodial care, for those activities of daily living that I mentioned, just getting around and you need help, that's not a skilled nursing care facility. So assisted living facilities is another type of location. And, some services may occur on an outpatient basis or in the home if the individual is a licensed professional coming to the home. So coverage can take place primarily related to licensed professionals. So hopefully that long answer answered your question.
Yes.
All right. Okay, so home health care, Part A or Part B may cover that, and that has to be coordinated through the doctor who has to place an order for that to be covered in the home setting. So some of the things that are covered with home health care by Medicare would be part-time or intermittent skilled nursing care, part-time or intermittent home health aid care. So if it's just home health aid, it would not work. You would have to have some other skilled services coming to the home in order for Medicare to pay for it. So in addition, the other services I mentioned earlier, from professionals, physical, speech, occupational therapy, medication, social services, those would be covered if there's some skilled services going on in the home intermittently. I want to talk about Medi-Cal, which is the name for Medicaid in California. Medicaid is a federal entitlement program for low-income citizens, and it's administered in California under the name of Medi-Cal, and you have to apply through the Medi-Cal office locally. If someone has both Medicare and Medi-Cal, it's called dual eligibility, and the primary payer is Medicare. They'll pay first, and additional payments would come from the Medi-Cal office. So if you've qualified for full Medi-Cal with Medicare, then the Medi-Cal would also cover your Part A and Part B deductibles, co-payments, and monthly Medicare Part B premium. Here's some very interesting and important information. Prior to July 1st, Medi-Cal coverage in a nursing home in California required individuals to have limited assets of $2,000. As of July 1st, 2022, this month, the asset limit increased to $130,000, a considerable increase. And this is for an individual, plus it has increased an additional $65,000 for each additional household member. And exempt property is property that is not counted in determining your eligibility for Medi-Cal. So I want to emphasize this point that the limited number of assets was 2,000. It is now 130,000.
That's a big jump, isn't it?
Definitely. So I wanted to make sure you guys heard that clearly.
Absolutely, because there's been too many people that I know did not qualify for Medicare, and they needed it badly.
Right.
This
So
good
that
news.
is a dramatic improvement. The other dramatic improvement is immigration status will no longer be a barrier to full scope Medi-Cal benefits for persons age 50. We're not talking just about age 65 now, age 50 and over. And for future reference, starting January 1st, 2024, assets will no longer be counted. Can you imagine that?
Assets, in other words, what you own will have no deterrent for you being eligible for Medi-Cal.
That's what they just declared.
Hallelujah in the sanctuary, okay?
Okay.
Oh, my God. Denise, let me just stop right there. Folks, that is huge. That is so large, because that's what people have been crying out for, because they have worked hard and they have their home. They want to leave something for their children or grandchildren, and they've been concerned about Medicare recovery. This is going to change things. My goodness. Okay.
All right. And I'll address that recovery as well. All right. So let's talk about currently with the asset limit at $130,000. They do not count your primary home you're living in. They do not count one vehicle, household goods and personal belongings, life insurance policy with a face value of $1,500 per person, and prepaid burial plans $1,500. The life insurance policy, that number is so low it's obsolete. We don't even need to think about that. Yeah. So main focus is they don't count your primary home and one vehicle and personal belongings. The assets that are counted are whatever cash you have, any money in a bank account, more than one vehicle, real property or land that the person does not live in. So let's talk about estate recovery for Medi-Cal beneficiaries. You've heard that federal law requires Medi-Cal how agencies to recoup payments for Medi-Cal benefits, long-term care, and home and community-based services for some, not all, Medi-Cal patients. Well, as of January 1st, 2017, repayment will be limited only to estate assets subject to probate owned by the deceased at the time of death. Another important reason to establish a living trust, which Dr. Rosie has been emphasizing over and over the years, and also what I emphasize over and over with my financial clients, because we want to minimize the pain and suffering and delay and cost of probate for our clients. So, as you can see, avoidance of probate is of utmost importance, keeping those assets out of probate.
Well, Denise, that seemed like a double whammy. You in probate, so you lose money. And because you're in probate, you have the Medicare recovery because you don't have a trust. Is that correct?
Now, I'm not sure. I didn't understand your question. Can you ask me again?
Yeah, I said the fact that they're in probate, they're losing money with probate costs and fees. But at the same time, they're subject to Medicare recovery if they're in probate, if they don't have a trust.
Right. Yeah. So, it's totally something you want to avoid, and they make it, clear and convenient for you if you have a living trust. You're better off. They're basically saying set up a living trust.
Yes.
That's the bottom line, and hopefully people will accept and take the time to do that. What are the alternative ways to pay for long-term care? We've heard over and over about long-term care insurance, and what you hear about long-term care insurance is that it's expensive because most people think about it when they're older and if they have an illness and there's a greater likelihood of them needing long-term care. Majority of people do not plan when they're younger to get that long-term care. So expense is a factor, and delay. And the other factor with regard to long-term care is if you don't use it, you lose it. So currently, a newer product that came on the market that addresses this, if you don't use it, you lose it, is what's called long-term care insurance rider associated with a life insurance policy. It can be a new policy, or it could be a policy where you transfer funds from an old policy into a new policy. And this may work for people who are older. The other way that people pay, the most common way that people pay for long-term care, which is probably the custodial care we're talking about for the majority of people in the home, is through their personal savings with home health aid workers assisting them. But if they're in a nursing facility, then they may need to pay those higher costs involved. Medicaid and Medi-Cal, we've addressed how that works for long-term care. Some people may have what's called a health savings account, which is a bank account that's set aside for tax-free payments for health care that they usually set up while they're working. Annuities can also have long-term care riders and usually require a large lump sum to set those up, and payment of the care is through that policy. Other types of annuities can also be used. If you're a veteran, the VA may be able to provide long-term care depending on the qualifying factors for the individual. One of the last resorts that's generally an option is to consider using the equity in your home, either as a reverse mortgage or using monthly payments toward long-term care costs. So those are some of the alternative ways for paying for long-term care.
Denise, I have a question. If a person take out a policy for long-term care insurance, does it say you do that at 25 or 30 at a younger age? Will the premium increase as you get older? And let me give the telephone number out because there are people who may have questions, but I want to set the show up first. The number is 310-928-7733. It's 310-928-7733.
Mm-hmm. Okay. With long-term care insurance policies, it's possible that common that the premium may increase, costs increase over the years. Inflation can be a factor. Healthcare costs can be a factor. So as long as you're paying the ongoing premium, you're guaranteed for it to be renewed, and the premiums can increase as the years go on. So long-term care, straightforward long-term care isn't very popular. There are too many cons, disadvantages with straightforward long-term care insurance. Generally, people in their 20s and 30s don't get it. It's usually, and it may not even be available that young of an age as straightforward long-term care insurance. But people are usually in their 40s or 50s when they decide to set up a long-term care insurance policy. Okay, so I will go over the questions that we initially started with. Will Medicare cover the total cost of skilled nursing care? Generally, no. The answer is no. Does it provide nursing home coverage indefinitely? No, it does not. Consider the 100-day period and the new benefit period rules. Can you pay out of pocket after Medicare coverage ends? Definitely. And my last question is, do you have a plan in place to cover those extra costs of long-term care? That's what this presentation is about, having a plan. And briefly, before we get on to other questions, I would like to mention that original Medicare involved Part A, the hospitalization, and Part B, the outpatient care, doctor visits, etc. So original Medicare is what you get when you get that red, white, and blue card. And for most people who are not on Social Security at age 65, they need to request that they be signed up for Part B. And if you delay signing up, then there could be penalties involved, whereby you pay additional Part B premium amount. The other type of Medicare insurance you may have heard of is called Medicare Supplement. And this also includes Part A and Part B. And in order to get coverage for prescriptions, you would need to have a separate Part D plan to pay for prescriptions and pay an additional premium in addition to Part B premium. You also need a separate Part D for prescriptions if you only have that original Medicare. And Medicare supplement is also called Medigap. The third type of Medicare that is very common is called Medicare Advantage Part C, and this includes Part A and Part B, and most of the time includes Part D. And it also offers additional benefits more so than the original Medicare. The Medigap, with that policy, you're with a private insurance company that you pay an additional premium in addition to the Part B premium, and then it covers that 20%. With the original Medicare, you have no backup for that 20%. You are responsible for that 20%, whether it's $100, $1,000, $10,000. So original Medicare is not something most people should have. They should make arrangements to have either Medicare supplement or a Medicare Advantage plan. At this point, would you like to go over some questions, or would you like me to go over some more details about the different types of Medicare plans?
Well, let me ask the question you was talking about with the 20%. And I think it's so important for people to understand all of what you're saying, because some people think that the 20%, well, that's not bad. But 20% of a hospital bill can be a lot of money. And if you're not able to pay it, think about, you could get a lien on your property, you could get a judgment. It's just so many things that people don't have the understanding of. That's why I think it's so important to have this type of information. But it's amazing, that Medicare only pays so many days. And then I often wonder, Denise, well, what is this $200 and some a month they taking from my Social Security check?
So the Part B premium is a requirement. That is the way it is. You have ongoing payments in order to be in the Medicare healthcare system. If you were paying
hold one second, Denise. The caller, we're going to come to you at 310, but make sure you come off your speaker. Okay, back to you, Dr. Denise. Because people ask the question, if I'm taking this money out, then they should pay forever for me. More than 100 days, they're still taking my money. So what is that money for?
Well, it's covering your health care, because we have insurance works by you pay a lower amount to along the way, and you get lots of financial benefit because the risk is spread out over a large number of people. If you are 70, 80 years old and you were paying a premium to a private company, you would be paying hundreds, if not thousands of dollars per month, because your risk is so much greater if you're older. The likelihood that company is going to spend, thousands of dollars on your health care is much greater. But you're spreading out the risk, and the amount we pay into Medicare during our lifetime oftentimes wouldn't even cover the cost of a hospitalization. Right. In addition to the fact that hospital costs are extremely high, and paying for health care out of your pocket is one of the primary reasons people become bankrupt.
Right. Well, I'm glad you explained that, because I've been mad about them taking that money every month. So now.
Well, paying $170, I think people should be thankful that it's only $170. It does go up every year.
I am now that you explained it to me. I think we have a caller. Caller, you can unmute and go ahead. You have a question? Call it 310. You can go ahead and ask your question. And I would like for you to go over. It was so important when you talked about what's happening for 2022. I would like for you to just kind of rehash that because that sounds really good to my ear. You talked about Medicare. Repeat that for me.
Okay,
you know?
I will. Okay.
That's good
As
news.
as of July 1st this month, the requirement to spend down your assets and not have assets greater than $2,000 to your name as an individual, that changed. Now you can have $130,000 set aside that still allows you to qualify for Medi-Cal in the state of California. And if there are additional members in the household, you can add on assets valuing $65,000.
That makes the average person eligible for Medicare, right?
Okay. Well, it's going to allow many, many more people to be able to get Medi-Cal. Many more people. In addition, for other people, the age has gone down to age 50. Yeah.
And you know why this information, Denise, is so important today? Because I get calls all the time from people wanting to make some great mistake, in my opinion, because they are told you need to transfer that house into your children's name, into somebody else's name.
No, so that's not correct.
I know, but this is what the public thinks is going to happen, that you cannot receive Medicare if you own a home. That's why not having the right information is so poisonous. It really is. So I really appreciate you for coming on here today with your wealth of information to share with us. So you can go ahead and tell us some more about 2022. I tell you, 2022, let me mark this. This is the year of excitement.
Yeah, well, it is exciting news, definitely. Mm-hmm. Okay. Are there any other questions?
Well, you said they can have a car. They can have one car that's in their name. They can own one home without looking for recovery. That's good news. Let's see. It's something else you said I thought was really important too.
The probate issue.
Yeah, the probate. Someone said to me in another state, they said, I don't see why anybody in California, because not all states deal with the recovery the way they do here in California. They said, I don't see why anybody in California with a home would not have a trust if it's no more than based on Medicare recovery, because that can be a lot of money.
That's true.
Your home health, when you have a home health nurse to come out, you get a wheelchair, you need a hospital bed, all of that stuff. I mean, that can come up to be a lot of money. I wish we had shows like this. Well, not shows, the information like what Denise is giving out to us today. That's what needs to be talked about. That's what we need to see on Channel 2, whatever channel that people watching, because this is the kind of information that causes people not to have, is what we call, to be able to pass down generational wealth. Because of this, because of Medicare, because of health and medical bill, is the reason a lot of people cannot pass down generational wealth.
Yes, you're definitely right.
Yeah. Did we have a caller, Keith, on the board?
We had one, but they hung up. I think one.
Shawana or Keith, which is the co-host, you guys have a comment or a question?
There was a question on the board that says, what about dental care?
Okay. With original Medicare, the first type is basic, where you have Part A and Part B. That does not cover dental care.
Okay.
Medicare, the second type, Medicare supplement, or Medigap is the other name for that. Usually they have supplemental dental care benefits, and you may pay a premium, additional premium separately for that. And vision and hearing are the other things that people commonly talk about as benefits they're interested in as they get older.
Mm.
With the Medicare Advantage plan, you have many of those benefits included to varying degrees. Originally, it was primarily just routine care for your dental needs. But as time has gone on, as each company becomes more competitive, they've been more inclusive with more coverage for additional dental procedures. So the Medicare Advantage plans, you can pay extra, or they have some that are inclusive without paying an additional premium for those. And that's a common, issue for older people. How do I get my dental care?
Mm.
So it's more likely to be included with the Medicare Advantage plan.
Wow. Well, going through this stuff sounds like you almost need a law degree to weave through this kind of stuff. That's what I'm listening to. So, wow, you sound like a lawyer.
I know. You don't know what you don't know, and oftentimes people don't seek knowledge, of someone who has that information for them.
How would a person know, okay, you get your red, white, and blue card. How would you know, do I need the advantage? I mean, you're so happy to get that red, white, and blue, you assume that everything come with it. It's going to be known to you, that you don't have to seek any information. Can you imagine how many people are not getting the benefits that's on the table for them because they don't know? That's what saddens my heart about this, that so many people have no clue. Now, is that one of the reasons that people are pushed into being a part of an HMO? Is it because they skip that 80%? That's what making people go from red, white, and blue to HMOs.
Okay. The original Medicare, this is just Part A and Part B, and you'd have to pay extra for the prescription drug portion. As I mentioned, is not advisable to just have that alone, because of that 20%, that could become $20,000 or more with a hospitalization. Right. So definitely, I advise people not to stick with that. So the other alternatives are either the Medicare supplement plan, which gives you the ability to go to any doctor, but with the Medicare Advantage, well, let me say this first. If someone travels around the country visiting relatives, stays in different places on a regular basis, and they see doctors in different locations around the country, the Medicare supplement is probably best for them, because they don't need a referral to see a doctor. They can see any Medicare doctor around the country. So you have flexibility with the Medicare supplement, and you pay that additional premium to have that freedom of choice and that flexibility.
Is that the same as the PPO, Denise?
No.
Okay.
No, Medicare supplement. Okay. With the HMO and PPO, they are part of the Medicare Advantage plan, Part C. That's the third option. If someone lives in a community, goes to the same doctor on a regular basis, that doctor refers them to their specialists and help them with, their special illnesses, so they need to see a specialist, then they have to go through that primary care doctor first to get that referral to the other doctor. That's how HMO works. You are in a network. So if you're comfortable with the doctor you have and you're not traveling, and you're happy with your doctor and a specialist, that's fine, because oftentimes you don't have to pay an additional premium in addition to the Part B for a lot of these Medicare Advantage plans. So it is less expensive, and you have additional benefits that include the dental, as I mentioned. There are additional things that are available, meals sometimes after you leave a hospital, home health aid services on a part-time basis temporarily are available. They even have what's called a robo-pet for people who live alone. It's a pet you can get included if it's ordered by the doctor, that this would be a benefit for your mental status. And people who have it just love that robo-pet, and it's like a little doggy. So they have these other extras just to help people, social connections and outreach. There are more things available with the Medicare Advantage if you're willing to be in a network. Now, with PPO, you also have a network, but at the same time, you can go outside of that network to see a doctor or a specialist. And if you go outside of the network, you may pay a little extra. So with the PPO, you have flexibility, and you don't need referrals with the PPO, and you don't have to stick to your network. And they have what's called special needs plan for people who have chronic illnesses, such as diabetes, heart disease, and they have specialists within the network for people like that. And they have special needs plans with coverage for people who have Medicare and Medi-Cal. So there is a lot going on within the Medicare Advantage circle.
Right. Now, Denise, do you do consultation? There are people listening who might want, most people don't know what their insurance plan or their policy that they have, even if it's long-term or whatever. I think people pay for policy and they never really look at what it says.
Yes, I do insurance policy reviews.
Okay. Let's give your information out again.
Okay, my email address, Davis, Davis, period, Denise, Denise, 69 @gmail.com. Phone number 310-721-7397.
Repeat that once more for me.
310-721-7397.
I really think it's time with everybody out there. I don't care what kind of insurance policy you have, even in another field, you need to connect with someone who can explain that to you. Because you can't wait until you need something to find out, like people when their house burned down, then they go, let me call and see if they cover what's in the garage. Or when they steal your car and you have a $5,000 computer and other stuff in it. Well, let me check and see if it covers the content. Folks, it's time for us to get into the know. That's really serious. Because there's too many of us don't even know how much our car insurance really covers. I tell people all the time, Denise, if they're in an accident and 5 people end up in intensive care, I guarantee you the average person doesn't have enough automobile insurance to cover their medical bill.
Mm-hmm.
Mm-hmm.
So I think it's time now that we really look at what we have. We can't wait until we need it and then to say, do you cover that? So this show is all about awareness and having you to dig deeper and take a look at what you have. Because if you're not planning for later years, I don't want to say old age. You know, the older you get, you don't want to use that word old age. If you're not planning for your later years, you may end up having to use up everything you thought you were going to leave for your kids. Because you may have to use it. So when you're thinking about generational wealth, do I have enough for me to still have something left to pass on to my children? So that's why you want to look at a plan. You want to get with somebody like Denise that can look at what you have and kind of help you shape a plan or direction. We don't know how to plan this by ourselves. You really don't. I need help. I
Right.
have to go to people. I do what I do. I know about estate planning. I know about a lot of stuff. But to really get to the depth of this, you need somebody who specializes, who knows about this. That's why I wanted her to come on to the show. And I hope you took her number down. And I talked to her about doing a Zoom presentation one day in the future for us, because we got to get this thing right. It doesn't make sense. They come out with some new laws that can impact you, and you still sitting there and don't even know that you are eligible for Medicare. So now you paying out of your pocket or begging your kids to help you. I'm telling you, not to have knowledge is really detrimental. It really is.
You're absolutely right. And you make very good points. That's for sure. People don't know what's in their insurance policy a lot of times until they have to file a claim.
Yeah.
And we always say in the insurance industry to check your policy on a regular basis, because insurance policies have changed tremendously over the decades. And, the amount you pay for a certain value, has, been more cost effective based on, the number of people they insure. There's so many reasons to reevaluate your policy. And even if you have a policy and you're older, you can oftentimes transfer value in a permanent cash value life insurance to an even better policy. And, especially relevant to this discussion, you could potentially use it toward a life insurance policy with a long-term care rider. And one last point, with the increase in the value of homes in recent years, a lot of people have not reevaluated their property insurance.
Right.
Because they may not have enough coverage for the higher value in their home. Mm-hmm.
Wow.
So, any closing
I'm
thoughts?
just
But I
sitting
guess
here.
you did give a closing thought just there. And I encourage the listeners to call me, because everything is on an individual basis. It depends on their circumstances. And or if there's someone they know who needs to evaluate their situation, if they're turning 65 or they're already on Medicare, then I could consult with them and see if they have everything in order or need to readdress the circumstances.
Or people that are about to be on Medicare in their 50s that need to prepare for it.
But,
Right.
It's available at age 65 unless someone's disabled at an earlier age.
Yeah.
So closer to age 65 is when I recommend that they start looking into it. Or if they're beyond 65 and still have their work insurance, that's when they would, start looking into it before they retire.
Wow. This is really, really interesting, for people to really get this information. And like Keith said, you almost need an attorney.
That's what it sounds like.
I think they write it up that way too. But I'm glad we have Denise, okay? So we can at least get that information. And I think it's so important. But one other thing I want to address, because I know I hear insurance and financial people talking about new product we have that you can benefit, Keith, in your lifetime, not just you paying all this money. So when you die, somebody gets something. They have a lot of product out now. I hear that if you have a catastrophic disease or whatever, that you can withdraw on that money in your lifetime with that type of policy.
Yeah, that's called accelerated benefits, where let's say you have a $500,000 life insurance policy.
Yeah.
Oftentimes, it's included that you can use those benefits in advance. If you have a terminal illness and you want to travel the world or spend it on your health care, they'll allow you to use that portion of that cash value in the insurance to pay. Actually, you have freedom to use it however you want to. And also, if you have a chronic illness, you can use it in advance. Or if you have a heart attack, you can use a portion. So those accelerated benefits for terminal illness, critical illness, chronic illness are available.
Do you provide
They've
them
been
with
available
that,
for a while.
Denise?
Yes, I do.
Okay, because
Yes.
what happens, if you have that type of insurance, then you won't have to get a reverse mortgage to pay for someone to provide care for you at home because your kid's not able to do it. Am I right?
Well, I won't say categorically that you won't have to. It can be another resource. Let's put it that way. If you have cash in, this has been around for a while now, cash in your insurance policy, especially the fixed index life insurance policies. For whole life policies, things can be a little bit different. But with those, if you have access to the cash value in your policy, you can use it for business. You can use it for whatever you want. It's like a personal loan to yourself. Right. And you could set one up for a grandchild, and that cash value grows in there. Don't have to pay taxes on it. You use it for their education, to set up a business, for down payment. I have used it for portion of the down payment on a house for my child, and I've used it for loans over the years to myself with the policy that I have. So you can do a lot of things with a cash value life insurance policy, not as much with a whole life, but whole life policies can be transferred over to, if the policy makes sense, the transfer makes sense to a different type of policy. So you brought out this additional point that I didn't address, but it's good information for them to know.
Yeah, and they know that they can contact you with this, because we really need to look at what can I do to reserve some of what I have, because I am big on passing down to the next generation. I'm big on that. Yes. So that's why I said.
Well, that's a topic we could address in another phone event.
Okay.
Yes, because that's also quite important.
Mm-hmm. Well, I want to thank you. Denise, do you want to give us a closing remark? And tonight at 6 p.m. Pacific Standard Time and 9 Eastern Standard Time, anybody who didn't get a chance to listen to this show, you can go to innerlightradio.com at 6 p.m. and this show will re-air. And I believe it's probably re-air many other times, because this is information that we need to get back. Denise, I'm going to listen to it over and over and over myself, because you've really given us a lot of good information. I really appreciate that. So you have a closing remark for us? Give us a closing remark and we're out of here.
Okay. So some of the important points that I made are that Medicare does not cover long-term custodial care, help just with the activities that someone cannot do by themselves. You need to have skilled nursing help in order to have Medicare cover that. And Medicare covers a limited period of time during your lifetime. You are not totally covered by Medicare for long-term care. The other point is that in California, you don't have to spend down to $2,000 solely. You can now have $139,000 of assets. You can maintain your home and maintain a car and be eligible for Medi-Cal to help with long-term care coverage in California. Those are, and also those people who do not have a living trust, if they go into probate, their assets that are still available may be accessible for recovery through the probate if they've received Medi-Cal benefits during their lifetime. So avoid probate and set up a living trust if it is applicable to you.
Now, Denise, one other question. With that 130 in assets, that does not include the home, right?
Does not include the home or one vehicle or
Okay.
personal belongings.
Okay. All right. I want to thank you, Keith. Did you benefit? Did you get a little knowledge from this?
No, yeah, like you said, I'm probably going to have to listen to it again because there's a lot of details. And like I said, she sounded like a lawyer, so she probably has a law degree. The complexity of the rules, man, it's like reading a legal contract. So
Yeah,
I have to listen to it again.
She knows her business.
But I hope I didn't make it too complicated for you. The bottom line is, I'm available to, explain it in more detail if someone does not understand or if they've forgotten something.
Well, I'm sure you simplified it. What I'm saying is,
yes, she did.
That's how complex these rules are, and a lot of people don't understand.
That's why we needed you. You broke it down. If we go someplace and read it, we'll probably be
we wouldn't understand it. Yeah.
So we thank you so much, and I definitely, would you come back at another time for us?
No, you know that I would do that for you if it's only for you.
Oh, I thank you so much.
Nice.
Shawana, did you get anything today?
Oh my God, she was just, yes, it was amazing. I know what I'm going to be asking my mom and dad, but I think they have this all under control. Yeah.
Shawana, you made a good point. This is something we need to start talking to our parents, our elderly people in our family, because they would have no clue about, do I have enough of this, or should I add this? Do I need supplemental? Most people don't even know if their prescription are covered. We really need to take it to the street and talk to the people in our families. I think churches need to be talking about this to their members. I really do. So you guys, the clock on the wall said that's all. Denise, I want to thank you again. You were excellent. We definitely want to have you come back. And Valid Girl, now you have more to explain to those real estate people. As to what kind of coverage do you
What kind of coverage do you have?
Yeah, it give us more knowledge. Yeah, when you're out here among the public, I think it's incumbent upon us to get all the information we can so we can pass it on to other people. That's what I do. So I'll be talking about this all next week. I'm going to be calling people. You should have heard this show. In fact, it probably will go on YouTube. If Denise doesn't mind, this show will go on YouTube. So Denise, call me and let me know if you're okay with that.
Yes, I'm fine with that.
Good. Then it's going to be on YouTube, because I'm telling you, we need to send everybody to listen to this, and they know they can go to the right person to get the information they need. Again, thank you. The clock on the wall said that's all. I'll see you all next week, same time. Have a great day as you go on your way.
Okay. Thank you.
Thank you.